Hey there, you beautiful souls. Lower back pain, hip pain, knee pain, or simply a tight hip flexor. I'm going to show you how 2 yoga blocks absolutely eliminated my right hip pain from too much driving and breaking my left knee. Make sure you stay to the end of the video because the extra credit bonus stretch is also fantastic if you've had any knee issues and to open up your hip. All of these exercises are in my online program with my link in the description below. But without further ado, let's get this done. All right, so we know this stretch is the pigeon stretch, and often we come directly up. If my leg is at 90 degrees, we can obviously tuck it under. For this exercise, I don't want to do that. So I'm going to keep my leg at 90 degrees. The problem with many people is they come directly up. It feels like a good stretch, but then later they start to notice they have some knee pain on that front leg, which is at 90 degrees. That is because the torque, the rotation is too much on the knee. Now, granted, we want some rotation in the knee. Too much, you're going to tear your ACL or something else in your knee. We want a little bit, but this often with people that are a little bit too tight, lacking the range of motion, is going to be too much. So the very like beginner way, when you don't even have yoga blocks, is what I want you to do is literally just sit in this 90-90 position. Get your, in this case, I'm going to do my bad leg. My right leg has the tightest hip flexor of the two. So this is going to be terrible, but I want you guys to see what it actually looks like. So here I'm going to put my right leg back as far as I can. Now, instead of me coming completely up and having this space between my knee and the ground or my butt in the ground, what I'm going to do is I'm not going to lean forward. I'm going to rotate my hip. We need to remember that joints work with rotation. So if we're always going forward and back or side to side, it's better than obviously smoking crack on the couch, but it's not the way the joints move. So what we want to do is try to rotate. So the great thing about this part of the stretch is you don't need any power. You don't need any strength. This one, not only is it going to put some torque on your knee, but you got to hold your body up. So it doesn't matter how heavy, how light, how fit, or how strong you are, you're going to get tired because your arm has to support everything. In this one, you need to rotate. So what I want to do is I'm going to take this side of my hip and I'm going to start to rotate into the stretch. And as I do that, I'm going to automatically on the other side of my hip kind of feel like it's punching out. But for me, my lack of range of motion is coming from my hip flexor. So right as I turn into this position, I feel this area right here is limiting me from going farther. So this is like stage one. You see I can move my foot around, I can put my foot down, I can turn it out. I prefer this position because we're internally rotating our leg. And what this will do is this is going to put even a greater stretch onto our hip flexor because our hip flexor actually wants to externally rotate our leg a little bit. And so from here, what I'm going to do is I can either simply just hold this. One way that you can use the yoga block is you can then, sorry, it's the same color as my carpet. Whoops, take my microphone there. Is I can now push myself more in an upward position, if you will. So, I mean, I can do that also with my hand, but by putting my other hand on a yoga block, it just makes it easier. And then I'm able to get in this pigeon-like position. Now the thing is the pigeon position is actually just supposed to be a split position with the back leg. So if we were like all super flexible and if somebody's watching this and you are, then you're able to sit in this position completely up without a problem because you can probably do the splits without an issue. And if you can't, then it's your front leg causing the issue, not the back leg. So back to this. I'm going to breathe in this position and I'm just going to kind of hang out, and because my hip is the shortened thing on this side, I'm focusing more on my hip flexor. You actually might feel it into your front leg, so more into your hip capsule. Mine is the hip flexor, that's why I like this position. Something I also like to do, which maybe I'm going to change my angle here just a bit, is now I'm going to take one of these blocks and I'm going to set it under my leg. It doesn't matter how you set it under. I apologize for it being the exact same color as the carpet. But what I can do now is I've got the left block under my leg here. So you can just see it sitting down like that. I set this down and then I can even move this block upwards and really get into this position. So now I'm back in that first position where I said you can put too much torque on your knee, if you will, but now I've got something I can rest on. So now the torque on my knee is less because I've got this support under my hip. Again, for me, my right hip flexor is my issue, so I like to focus this stretch more on my hip flexor so I can feel it deep inside here, focusing more on really internally rotating that right leg of mine versus focusing on the front leg of mine. Now, you can focus on both. You can focus on your front side. You can do both sides, which is something we always want to do because at the end of the day, the balance of our body is completely the most important thing, I would say. So if one side is completely off or worse or tighter or this or that than the other side, I always say it's like Team Navy SEALs versus Team Toddlers in like a tug of war. It's a disaster for everybody and nobody has fun. With that team toddler concept, I'm going to backpedal a bit and say I always believe that the pain in the body comes from basically 4 categories. One, we have movement. So under the movement umbrella, are we doing it correctly and basically enough? And then we have the strength umbrella, if you will, the category, the pillar. And under strength, I think a lot of times physical therapy focuses on not having enough strength. If that was the issue, why does my grandmother and the best CrossFit athlete in the world both have lower back pain? Are they both weak? One can make an argument for the ratio of strength that they have compared to what they're doing. I think it's more of a lack of movement, B, an imbalance between something in their system, so maybe the right hip flexor and the left hip flexor, or C, just in the CrossFit person's example, just overtraining. So we have movement, we have strength. I like to use the word mobility wrong, basically. For me, because it fits easier into the concept, under the pillar of mobility would be basically any type of massage with an inanimate object. So a foam roller, a tennis ball, a Psoas release tool. Anytime we work on any part of our body with something, it shouldn't hurt. You should feel it because you're not dead, but it shouldn't be so incredibly painful that you can barely do it. That is your body screaming that something is wrong, and I always say that pain is the language of the body. We just need to learn how to interpret it with the Rosetta Stone, if you will, yeah? So we've got what? Movement, strength, mobility, and then the 4th one would be flexibility. Now, if you're doing this stretch, and this is super easy for you, and you can drop into the splits without a problem at all, then the category of flexibility is not that important for you. I would say continue to do it, just so you don't lose it, but you should be focusing on something else. For example, when I had some Cirque du Soleil athletes, or when I was working with the Stuttgart Ballet, flexibility was not an issue for them. However, just like a Formula One engine or a Toyota engine, the oil needs to be changed. And I believe that, in my definition of mobility, is what is important. So everybody needs to do some type of myofascial work. And that is why I put mobility into the category as foam rolling or tennis balls, Theraguns, something in which we work on the muscle but not necessarily the flexibility. So those 4 categories is what I'm always looking at, and the reason I go into the stretching is my movement is fine, my strength is fine, my mobility is good. I can basically do all foam rolling exercises and not have any issues, but as you can see, my flexibility in the 4 categories is the worst. So that is my Team Toddler and Navy SEAL issue, which I need to focus on from the whole category. And then for me, my right side is my hip, and then when I go into the other side, my right side is my hip flexor, and then when I go into this other position, it's going to be more of actually my hip on that same side. So know the area that you want to work on, because then you can work smarter and not harder. So as when I used to work pro sports, I always said professionals work smarter, not harder, and the champions do both. So we want something that's obviously consistent, so you do it consistently and you don't burn yourself out, but we also want to make sure we're working smarter and we're focusing on the areas that we need to focus on. If somebody can do this and it doesn't bother them, do it, but you don't need to do it as much as me, because I can't do it very well, and this completely opens my hip. So as a final piece in this stretch, I'm going to kind of not follow my own directions, and what I'm going to do is I'm going to put my leg back at 90, and I am going to come up with my knee in the air, but I've already warmed myself up, and what I'm doing now is not trying to slam myself down, but because joints work in rotation, I'm almost trying to extend myself in both ways, because if my left hip were to rotate, that would bring me more forward, and if my right hip were to rotate, that would bring me more back. So basically, it's like a dual rotation, if you will, rotating me out forward and rotating me out back, and that is going to slowly lower me down. So again, if we understand the role of the joints, no pun intended, then we understand how we can go deeper into the stretch without hurting ourselves. Now, what I'm going to do actually is even grab one of those yoga blocks, because then I can push myself higher up, which is going to get my hip flexor more on this side. All right, and as promised, the extra credit test. So first, start literally just sitting with your legs crossed, and then cross them the other direction. I had horrible lower back pain a few years ago, and literally just switching my legs from being crossed and then creating a stretch, out of each of it was what helped. I'm gonna skip ahead of that and I'm gonna show you the more dramatic version. So what I want you to do is cross, let's say your left leg, for example, to 90 degrees-ish. And now what I'm gonna do is I'm gonna take my right leg, my foot, and I'm gonna match it with my knee. So I don't wanna like sprain my ankle. I want to pretend like this is one solid lever here. And from here, depending on how tight this is, you can sit against a wall because you're gonna maybe wanna fall back. You can put your hands down. You can do whatever you want. The goal is if you can get yourself stacked, if you will, in this position, and then from here, you can do whatever you want. I used to turn into it like this because then I would actually feel it almost above my hip into my hip joint. Or you can turn this way and you can push down, or you can just completely sit up. I'm gonna rotate myself here a bit so you can see me. So when I did it like this, I would really, and I still do actually, feel it right in here. This is really nice because we're getting to that, into the hip joint capsule, the fibril cartilage, the more of the fascia, but also the muscle. But that's why it's gonna feel a little bit more disgusting, if you will. And from here, I also like to sometimes grab my other knee, sit like this, and you can kind of rotate back and forth because then you get your own little like mobilization of your hip, and just kind of try to straighten your spine and just do whatever feels good and disgusting at the same time. And you just want to try to kind of open this area up, and the goal really, and I'm a fantastic example of being a disaster here, should be the knee on the foot. So if you can easily do this, like I said in the beginning part of the video, awesome, then just make sure you don't lose it, but you don't need to do it as much as me. And again, you want to compare both sides because of the whole Team Navy SEALs, Team Toddlers example I gave in the video, the exercises before. So here, I'll even turn this way so you can see it. I think for sure my left knee is better. This ends up turning into, it's kind of funny actually, the Faber test for us physical therapists or athletic trainers, the orthopedic test. Faber stands for what? Flexion, abduction, and external rotation. And that's exactly what you're doing here. We would lie the patient down, we would put them in a similar position to this, and then we would like push their knee down. And usually that means either a jacked up sacroiliac joint, or in my case, and with a lot of my clients' cases, it's an issue with the Psoas, so the hip flexor. Let's keep it simple. And this is one of my favorite stretches because on both legs, ironically, I feel it on that right side, which if you remember from the beginning of the video, that is my tight hip flexor just from too much driving, from pushing the gas and the brake all the time and always having it bent and externally rotated in the car. So I'm still undoing a bunch of that, but everything can be undone. I can't say it enough. I'm now 43 years old and I have less issues I had than when I was like 28 or 32. You just need to get back to doing what you're doing because it has nothing to do with the age of which you are. It has to do with how long you've been not taking care of yourself. If we started sitting when we were 10 years old due to class, by 20 it was 10 years, by 30 it's 20 years, by 40 it's 30 years. If you don't change the oil in your car for, I don't know, a year, you're probably fine. 5 years, your car would totally be a disaster, but you can't blame it on the car and you can't blame it on the 5 years. It's just for the fact that you didn't take care of it. Your body is the same way, so let's treat it well, just like you would the Lamborghini that you always wanted. So if you enjoyed that video, please hit that like, subscribe button, comment below, share with your friends that have hip pain, knee pain, or just need someone that actually truly wants to help them. All the links for all of my programs and personal consultations are down in the description below. And until next time, which will technically be tomorrow, because I'm going a little bit crazy with filming right now, you all have a beautiful day. It's dark, it's Jesus outside in Stuttgart, Germany, so I hope you have a little bit more sun and warmer weather than we do.